The psychology portion of the psychiatry chapter tends to include some of the more conceptual topics covered on the boards. These tend not to be tested directly, but are still important foundational concepts to master when we discuss psychopathology in the next talk. The first concept we'll want to talk about is classical conditioning. It's a little complicated in the abstract, so we're going to try and make it more digestible by discussing it in the context of Pavlov's classic experiment with dogs. Let's start with the idea of an unconditioned stimulus. An unconditioned stimulus is something that causes an organism to automatically respond somehow. In this case, the unconditioned stimulus was food. The dogs react to it automatically without any training required. Whenever they encounter the food, the unconditioned stimulus, they have an unconditioned response. Basically, they salivate. They didn't need to learn to salivate when food is around, they just do it naturally. Now, every time Pavlov was about to give the dogs food, he'd ring a bell. Eventually, the dogs learned that the sound of the bell meant that they were about to get food. The bell became a conditioned stimulus. It became a conditioned stimulus because the dogs had been conditioned to associate it with the unconditioned stimulus, the food. So after a while, just the sound of the bell alone would cause them to salivate. When the bell alone caused them to salivate, salivation became a conditioned response. They had to learn to salivate when presented with the sound of the bell. Operant conditioning refers to a different type of learning in which an action is elicited because it produces a reward. This differs from classical conditioning in that classical conditioning is based solely on associating a stimulus with events. No reward or punishment is required. There are multiple types of operant conditioning. Positive reinforcement refers to a desired reward that produces an action. For example, a mouse will be more likely to press a lever if it is given food each time it does so. In contrast, in negative reinforcement, an aversive stimulus is avoided with an action. For example, a mouse is more likely to press a lever if it removes an electrical shock. This should not be confused with punishment, which is an application of an aversive stimulus in response to an undesired action, rather than teaching a desired behavior by linking the behavior to avoidance of an aversive stimulus. It's a subtle but an important distinction. A better example of punishment is a child who takes cookies from the cookie jar who no longer steals cookies after being punished with a timeout. Finally, with extinction, if reinforcement stops, then the behavior is eliminated. For example, the dog will stop coming when you blow a whistle if it doesn't get a treat. Transference refers to a patient who projects his or her feelings about formative or other important persons onto the physician. For example, in this picture, the patient is noticing the height similarity between his father and his physician. Countertransference refers to a doctor who projects his or her feelings about formative or other important persons onto the patient. Remember, transference and countertransference are patient-centered, just like a doctor should be. That is to say, the base term, transference, refers to the patient, and the reactive term, countertransference, refers to the doctor. This should help you keep the two straight. There are many different types of ego defenses, most of which may appear on your boards, as they tend to be commonly tested concepts. While there are a lot, it is worthwhile to memorize these, as you will likely see them repeatedly as you study. Basically, these defenses are unconscious processes of the ego that are used to resolve inner conflict. There are two basic types, immature, which are thought to be more primitive, and mature, which are thought to be less primitive. We'll go through each of these with a focus on examples. Let's start with the immature defenses. Acting out is quite literally what it sounds like. Imagine a child having a tantrum because they aren't allowed to have candy. This is basically an immature way of expressing their inner frustration. Dissociation refers to temporary, drastic changes in personality, memory, consciousness, or motor behavior to avoid emotional stress. The extreme forms of these dissociations involve patients with dissociative identity disorder, where they develop multiple personalities to avoid dealing with inner stress, classically child or sexual abuse. Next, we have denial, which is a classic defense mechanism. Classic examples are AIDS and cancer patients who deny their diagnosis, not believing their painful reality truly exists. Simply stated, displacement can be thought of with the example of a guy who is angry at his boss but chooses to be mean to his girlfriend instead because it is more acceptable to displace his anger to his girlfriend, at least in his mind. Fixation is when an individual shows isolated behavior characteristics of an earlier stage of development, such as an otherwise normal older man who still carries around a security blanket. This is in contrast to aggression, when a person completely reverts back to an earlier maturational age. Identification is a more obscure defense mechanism. It refers to an individual who models their behavior after someone who is thought to be more powerful. An example would be an abused child who takes on the identity of an abuser. Next, we have isolation of affect, wherein individuals will separate their feelings from certain ideas. For example, a witness of a murder will describe the murder in graphic detail without showing any signs of an emotional response. Just as a side note, the word affect is sometimes used in place of the word emotion. Projection refers to an unacceptable internal impulse that is then attributed to an external source. For example, a man who wants to cheat on his wife then goes on to accuse his wife of cheating on him. Rationalization is a way of logically explaining an action or event even though it happened for another reason. One example would be a person who has a drinking problem but then says she's had a hard day and needs a drink. I guess it's kind of disturbing that the individual in this picture is a doctor. Keep in mind, it's just a hypothetical example. Reaction formation refers to a process whereby a warded-off idea or feeling is replaced by an emphasis on its opposite. For example, a patient who is obsessed with sex may go on to enter a monastery. Regression is exactly what it sounds like. Think about an adolescent who under stress begins wetting the bed, or in the case of the picture, an adult who reverts back to sucking her thumb. Repression refers to an involuntary withholding of an idea or feeling from conscious awareness. For example, a rape victim will unconsciously lose all memories of the event. Splitting refers to an individual who views people as either all good or all bad. This is classically seen in patients with borderline personality disorder. We will discuss this again when we discuss personality disorders. An example of this is a patient who believes all nurses are cold and insensitive, but that all doctors are warm and friendly. There are also more mature defense mechanisms. Remember, these are thought to be the less primitive defense mechanisms and are seen as better ways of dealing with unacceptable thoughts or feelings. They can be remembered with the mnemonic mature women wear a sash, S-A-S-H, sublimation, altruism, suppression, and humor. The first defense mechanism is altruism, which refers to the use of unsolicited generosity that alleviates underlying guilty feelings. For example, a mafia boss that makes a large donation to charity. This differs from reaction formation because it is a conscious decision, whereas reaction formation is an unconscious emphasis on opposite feelings. Humor involves appreciation of the amusing elements of an anxiety-provoking or adverse situation. Think of a nervous medical student who likes to joke about the boards, and don't get too fazed by the picture. Sublimation refers to a process wherein a person with unacceptable desires replaces those desires with similar ones that are seen as more acceptable. For example, think of a bully who chooses to join the football team as an outlet for his unacceptable wishes to bully other kids, or an athlete who sublimates his desire for something he can't have into motivation to train. Finally, we have suppression, which refers to a voluntary withholding of an idea or feeling from consciousness. This is similar to repression, except in repression, the idea is unconsciously withheld. A good example is a nervous boyfriend who chooses not to think about his first meeting with his girlfriend's parents until the day before the encounter. Well, that was definitely a lot of information. At some point, you should come back and plan to review this information one more time.